All right. Well, part two of multi-systems trauma and special considerations in trauma. So, so management considerations with pediatric patients. Um, Again, they compensate very well. It's when they start decompensating. And so I mentioned the capillary refill. And with that capillary refill, um, it's a very good indicator of what's going on. Be quiet, Mickey. And it will tell us if they're not perfusing very well. So one thing to keep an eye on is the fact that they have poor perfusion, slowed capillary refill. Uh, uh, um, anyway, with hypovolemia, because they compensate, we have to be suspicious of it. Not much we could do, but it is a form of shock. Um, so there are things that we can do, covering them up, laying supine, elevating the legs, rapid transport, O2. But when we transport them, we want to make sure we take them to a pediatric trauma center. So make sure that you do. Out here, it would probably be either Providence, but most likely UMC. So make sure you take them there. And just keep an eye on them, reassess them constantly, because they will deteriorate very quickly. All right. I've been very fortunate, although it kind of sucks, but I've been very fortunate that I've only had one serious pediatric call in my career. And that was that 19-month-old that I told you got hit by that H3, I believe it was. And he did deteriorate very, very quickly. And so seeing that, it's just a horrible thing to have to experience. So, now, as far as elderly patients, the risk of death or significant injury is greatly increased because they're not able to compensate as well as they used to when they were younger. Blood loss will really affect them. They don't have a lot of protective mechanisms, and they might even have other comorbidity factors. In other words, things that weaken their body to begin with. They could be on blood thinners. They have high blood pressure or diabetes or heart disease, and so the heart's not as effective anymore. So there are things that make it more dangerous for them. One of the saddest things that I see with elderly women in particular is they still are active, they move around and everything, and all of a sudden they experienced a fall and they broke a hip or a pelvis, but usually a hip. And to see them after that injury, they're not the same anymore. And he really, even with my grandfather, after he was assaulted and left for dead, he just wasn't the same person anymore. And after that, he didn't last very long. He wasn't active anymore, and it really did him in. But knowing, like with the elderly women, the fractured hip, they get a hip replacement, or they get surgery to fix that broken hip, and they last just a few years more, and they die. And so that's always a bad thing. Now, with elderly patients, with geriatric patients, and what's a geriatric patient? What age? Can you guys hear me?
Yes.
Yes, sir.
Just making sure you guys were awfully quiet. How old are geriatric patients? At least what?
Over 65?
Yep, over 65.
I think that's crazy. Should be higher,
No.
like 75, 72.
Hey, my mother's 73. Watch yourself.
75.
Good answer.
65 so young. My parents are sitting right here in front of me.
Ah, okay. That explains it. Plus, don't worry, I'll give her an extra hard quiz just for you, Vanessa's mom and dad. I got your back.
They're smiling.
So, when you have a geriatric patient and they suffer a fall, do not assume that it's a mechanical fall. In other words, don't think that they tripped on something. They might tell you, I think I tripped on my carpet. Okay. You have to rule out something else. Always ask them. Best question to ask them is, were you feeling weak or dizzy prior to your fall? It could be that they might have a heart problem and caused a lack of blood flow to the brain and caused them to feel faint, and that's what caused them to fall. So you always want to rule out some other cause before you go down the mechanical fall part. And again, a mechanical fall is just how it sounds, mechanical. They tripped over their feet. They tripped over a power cord. They tripped over the rug or the lip of the steps or something like that. So that's a mechanical fall. Something caused them to fall. Okay. Very, very, very important when you're dealing with geriatric patients and falls. Now, there's a whole chapter on geriatrics. And I'm trying to remember, did we talk about the changes that occur after we hit 30? We did?
Yeah.
I usually do. And I remember going over lifespan development and my payback to you young guns. So we know there's some changes that occur. Because of those changes, the patient might not be able to compensate. We talked about that a minute ago. Because of their heart's inability to pump effectively, it's not able to squeeze out harder to maintain a blood pressure. The arteries become thicker or harder, so there's more there's not as much stretch. Excuse me. They're not able to maintain their body heat, their body temperature. So there's those issues there. So changes that occur because of aging makes them more susceptible to traumatic injuries. Again, we were talking about women with osteoporosis. So significant car crash, can they have fractured hips, fractured pelvis, fractured femurs, fractured forearms? Can they suffer more of broken bones?
Yes.
Yes. All right. What else? It's funny, whenever Michelle goes home, I always tell her, did you forget anything? And today, because she left later than she usually does, I didn't get a chance to remind her. And what happens? She forgot her keys here. So now she's on the way back to get her keys. So. All right. So who can tell me a couple medications that can affect the patient's outcome as far as trauma issues? In other words, what's going to make things more difficult for an elderly patient?
Like Coumadin and
Coumadin.
yeah, all of those.
Okay, what does Coumadin do?
The bleeding might not stop.
Okay, the prolonged bleeding. Why? What does Coumadin do?
It thins the blood.
Okay, but that's not really what it does.
Platelet aggregation. It
prevents platelet aggregation. Okay, what does that mean? I'm a student, so I don't know what that means. What does that mean?
It prevents your blood from coagulating.
Okay. So it's preventing the blood from clotting up to stop any bleeding. So there's
Those are usually like that one and metformin are usually used for like diabetic patients, no?
Well, the metformin, yes. The Coumadin, I guess they can. But before Coumadin, what else will they give?
The aspirin?
Exactly, aspirin. And so the reason why I had to think about it was because I am on an anticoagulant. I'm on Plavix. So I don't know why they didn't go to Coumadin, but they did give me the Plavix because I'm allergic to aspirin. And yeah, because of somewhat sedentary life now, and because I was getting a lot of cramps, the doctor felt it was better to start on the anticoagulant regimen. Yes.
Okay.
Okay. So Coumadin's one, Plavix, aspirin. What else?
Warfarin.
It's Coumadin and warfarin are the same thing.
Eliquis.
Okay, so we're still with the anti-clotting. Let's go on to something that's not for clotting.
Oh, like a beta blocker?
Okay, what's that going to do?
It's gonna maintain the blood pressure so that you can't tell there's an issue.
Okay. Besides controlling blood pressure, what does it do?
Yeah.
Anybody?
Can you repeat yourself again, sir? Sorry.
What else besides controlling the blood pressure do beta blockers do?
Like directly involving the heart?
Yes.
It slows it down.
What?
It prevents it from beating as hard or with as much force.
Well, that's controlling the blood pressure. How about controlling the heart rate? Remember I told you if you suspect shock and their pulse rate is normal, still suspect shock. Because think about it. Somebody was just involved in an accident or they just suffered a traumatic injury. Regardless of shock or not, wouldn't their pulse rate be up?
Yeah.
Yeah.
Yeah. But their pulse rate is 80. Is that normal?
Yeah.
So think about that stuff. What about pre-existing medical conditions? Give me an example or two.
Osteoporosis.
Osteoporosis, the break in the bone.
And you said that osteoporosis happens more with women.
Yes.
Why?
I don't know, to be honest with you. See what I can find out.
What? A question you don't know?
Yeah, I am human. If I knew everything, I'd be a doctor.
True. Okay. That's a good question to research.
That's what I'm doing. Because women usually have smaller, thinner, less dense bones than men. And you lose a lot more bone mass after menopause, so they become more brittle.
So if I'm big boned, I don't have to worry about it?
Yeah.
Wait, but you guys also go through menopause.
Yeah, because we had to suffer through your menopause. It's called
Well, that's your fault. That's men's fault.
Word.
That's why they call it menopause,
Oh God.
because it's a man's fault. I just love the smiles on all the women's faces.
Hmm.
It's all Carlos's fault. How about that? Andrew's like, yeah, just don't involve me.
He has more menopause than a girl does. Trust me.
Who, Carlos?
Yes.
Hi, Carlos. What would you do
Right now he lost his headphones. He had him on him and then he blames me and goes crazy on me. I'm like, okay, calm down.
Jeez, Carlos. Bone density, all that good stuff. All right. Anything else?
Maybe if the patient suffers from angina, like chest pains, and they're taking calcium channel blockers.
Okay. Mm. Okay, same thing. It's slowing down the contractions of the heart, not make them so forceful. And so okay. It's interesting you would mention that, but no, you're right in that. Is it able to boost up the blood pressure with fluid loss, blood loss?
No.
Exactly. So we could have perfusion issues to the brain. Okay. Also, I was thinking about the decreased ability of the lungs in air. They're not as elastic anymore. So we have an oxygenation issue there. So altered mental status, very significant sign of issues with the patient. Oh, sorry, my feet are just burning. Now, another thing that they have is dentures, or they may have dentures. And the thing about like oral trauma or facial trauma, it can break the dentures. And so we worry about the pieces of the dentures going into the back of the airway. I see. Speaking of dentures. Have you seen those little ladies with the hunchbacks? No,
Yes.
yeah, you don't have to look very far. Just look at me. You've seen how I have a little bit of a hump on my back.
Yes.
And have you noticed when you put me on a backboard how my neck is all stretched out, my head is all back? So it's called kyphosis. And so you gotta kind of take care of the little old ladies and the little old teachers, when they have that. So you need to put padding because one, that's a lot of pressure, and two, that's going to close off the airway. So we go back to, Joanna, pay attention.
I am. It's because I just dropped something on me. That's why.
Well, pick it up and eat it.
No, I'm all dirty. I can't.
So anyway, put padding, just like with kids, put padding to maintain a kind of the airway in alignment. Okay. What else? Can we give elderly COPD patients high flow O2?
No.
No, well, you can, but isn't it like not really needed?
But it's a trauma patient. So is a trauma patient going to need it? Sorry, I just passed out there.
Oh, okay, yeah. I was just
Yeah.
putting.
You were just testing me to make sure I knew?
Yeah, we were just making sure we weren't going back to the other chapter of COPD.
Okay.
So then you can?
Yeah.
Oh.
Trauma patient needs oxygen. Give it to them. Remember, the amount of time that we have them is not significant enough to throw off their respiratory drive. So at my young old age, I suffer from Alzheimer's instead of Alzheimer's. It's a joke. Get it? All Alzheimer's, Alzheimer's. Get it?
Yeah.
Anyway, any type of cognitive issue, they're more prone to accidents because they don't know what's going on. They don't realize what they're doing. Now, in our assessment, we're going to find challenges because if you ask them, do you feel any pain? Where does it hurt? Is an autistic person? No, I know. I'm channeling I know now. Can't talk. Hey, I'm over here. I feel like a dad.
Worse than a dad, sir.
Hey now. Hey, you didn't grow up with my dad where if we didn't pay attention to church, we got the pinch. Oh, I could still feel those pinches. And used to get a lot of meat, so those really hurt.
I love meat.
And he had big hands. Autistic kids and autistic individuals, it's harder for them to express anything. Some of them don't talk. So how can they tell you, ow, I hit my head and I have a headache? They can't.
Plus,
So
they have they have high tolerance with pain too.
They can, but what if it's a high-speed vehicle collision? What if it's they're in a school bus and the school bus was hit and it flipped over?
Oh,
So you're right, but there's other possibilities as well. So it might be more difficult to assess them, and it will be more difficult to assess autistic or certain cognitive issues. Here's something else. Seeing on here, stroke. What if they have a stroke that affects their cognitive abilities? One of my best friends, she had a stroke, and she ended up having what they call what was on her left side, so she had left neglect. In other words, things on her left side, you could put your hand right next to her here, like by your ear or her ear, and she didn't know you had your hand out. Even if you had it in front of her, she couldn't see it because her brain didn't process the left side. And so if they can't feel or sense anything on the left side and they have a significant burn, are they going to be able to tell or know that they have a significant burn on their left forearm? So how much does it hurt? Huh? It hurts? I don't know. Here you go. Down syndrome. Getting down to their level. Now, some individuals with Down syndrome are very developmentally delayed. They might be 25 years old, but they act like an 8-year-old. And you got other regular 30-year-olds, Carlos, that acts like an 8-year-old, peleando con Joanna. Oh man, he got up real quick.
First of all, I'm not 30, FYI.
I'm sorry, you're 32.
No.
Hey, I'm an equal opportunity picker on her. Anyway, but there are some, and I'm sure you've seen or you've heard of that show on was it TLC? I forget the name of it, but it had a bunch of individuals that had Down syndrome.
Born This Way.
Yeah, there you go, Born This Way. And did they act like 7-year-olds?
Mhm.
I remember watching commercials where they're talking about getting married and having kids.
Yeah,
Scary, huh?
it was crazy to watch.
Yeah. I saw a couple episodes. I don't remember much about them, but they could lead fairly normal lives. I mean, there's still a little bit there's some cognitive delays, but I mean, there's been Down syndrome individuals that have been actors. They've had to be able to memorize lines. I don't know if they canceled it or not, but a show on NBC, or I'm sorry, oh, that hurt. On ABC called Stumptown. Did you guys watch it? You guys watch any TV at all? And I don't mean Carlos Playboy TV. I mean like regular TV.
No, I watch soccer. That's it.
Watch what?
I watch soccer. That's it.
I'm hearing Grey's Anatomy. What?
Grey's Anatomy. No, I hate that show.
I watched that.
You're like a McDreamy fan, aren't you?
Who, Carlos or me?
Carlos.
Nah, he's more like of a George fan.
All right. When you have a cognitively impaired individual, for whatever reason, Downs or stroke or autism or whatever, they'll have a caretaker. So caretaker can give you information. Pay attention to what they're telling you. Obviously, you always want to look for signs of abuse, but they can give you information on them. The other thing they can tell you that you need to ask is, how are they acting right now compared to normal? Or is this normal for them? So if they're normally like ANO times 2, is that normal for them? Okay, is that normal for them? Mm, 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 mm. What else? We talked about that. Talked about pain. Um, uh, uh, doing your assessment, got your information, do your assessment, look for the clues, look for injuries, be a psychic, anticipate other injuries. Also, like with cognitive, remember I mentioned about asking the caretaker, is this normal for them? If it's not, is it because they suffered a head injury? Did they fall and hit their heads? Because remember, elderly and even cognitive impaired are very susceptible to trauma and to falls. And so is the way they're acting as a result of their pre-existing condition, or is it a result of the trauma that they suffered? So be sure to ask. Remember, I've told you guys before, it's about asking questions. So err on the side of caution when you're assessing them. All right. So as far as your scene size up, look at the mechanism. If you see a car that's really mangled up, you got to be thinking about that trauma.
Okay, that's fine. Thank you. Okay, thank you.
Hear you, Jana. So 11 more sessions after today?
Yes.
So looking at some of these pictures, so you see that impact? You see the breaking on the windshield? Although that could be more from the body damage to it causing that. What do you think? Would this patient on the either side suffer multi-system trauma?
Yes.
Yeah.
Yep. What do you think about that damage?
Yes.
Mm-hmm. Although the front end looks pretty bashed in, but if you look at the windshield, you don't get that much of an impression that it was too bad. There you go. What do you think? Bad?
Yes.
Yeah. Look at the tire. So the axle is bent. Look how far in this is brought in. Where's the rest of the front? What happened to the motor? And you look, can you see the windshield? That's not just what I wanted to. I'd seen a, oh, there we go. What do you think?
It's bad. Horrible.
Show up to this call. Is that one of those oh shit factors?
Yes.
Yes.
¿Qué tal ese? Oh, this, it kind of looks like this was from a tornado, but still.
Or a really bad rollover.
Uh-huh. So a good example of multi-systems trauma. Head injury, spinal injury, chest, extremities. Now, could this person been decapitated or suffered a crush injury to the skull before they died?
Definitely yes.
Yeah. Let's look at this one. This one looks interesting too.
Oh.
So what happened to the patient in the driver's seat? Just kind of, as you're sitting there, think about you sitting in that driver's seat and you get impacted. Carlos, pay attention. I swear I feel like a dad sometimes. Now think about that impact. It's gonna bring you back, right? Good good indication for a neck injury. And then if there's intrusion because of the bent A post, I would hate to go forward. You're grabbing the steering wheel and it happens so fast because it looks like there was high speed involved. What's going to happen to your forearm?
Gonna break.
Or your shoulder.
Even break or dislocate, and then like break broken legs, pelvis probably.
There you go. So hard it knocked the engine out. Anyway. So in your scene size up, that's what you want to be looking for. Remember that general impression? Did some of these make you go, oh shit? Yeah. That's what I want you guys to look at. Is what's making me go, oh shit, that sucks. So again, don't assume that the ultramal status is a result of a pre-existing condition. It could be a result of a head injury. Oh, there's another good one. I just remembered we didn't cover head injuries too much, but Joanna has suffered a head injury and she's feeling nauseous and she vomits. So normally when Joanna gets nice and drunk and she starts vomiting, where does that vomit go? Sacrifice to the porcelain god? Besides that, normally when you throw up, think about when you've thrown up. It just kind of comes out of your mouth. You kind of aim it at the toilet, aim it at the sink, right? With a head injury, though, what you'll see is what we call projectile vomiting. In other words, like I said, Joanna suffered a head injury and she's feeling nauseous and she vomits. She's going to be able to vomit on Carlos's face because it's projecting, it's projectile. It goes further out, again, being able to strike Carlos right in front of her. And then he opens his mouth, it's going to be worse. So I teach him not to chew gum while he's around Joanna. All right, so I'm seeing eyes roll, so I'll move on. Is a slow heart rate for kids a bad sign?
A what?
Slow heart rate.
Yes.
Yes.
Yes, it is. Remember what I said. They don't lean on their cardiovascular system. For an adult, okay, there's a heart issue. With kids, when they go into respiratory failure, their pulse is going to go down. They've been leaning on their respiratory drive, and as a result, you'll see the heart rate start to go down. Now, earlier I mentioned how the number one cause of cardiac arrest amongst kids is what?
Respiratory failure.
No. I didn't say
That's what you
respiratory
said?
failure. I didn't say respiratory failure.
Let me see.
The number one cause of cardiac arrest amongst kids is what?
Respiratory issues.
Respiratory issues. Okay. What we need to do in that case is aggressive airway management. Aggressive airway management. So Claudia, what must we do?
Give them oxygen.
It's more than that.
For the BBM, bag them.
Aggressive airway management.
Aggressive. Aggressive. Okay.
Because on Monday, August the 10th, when I come back from vacation,
Aggressive.
I'm gonna miss the pediatric chapter. Dang it.
Aggressive what again?
You know what? I'm gonna try and log in and do this class.
Aggressive what again?
Airway management. One more time. Aggressive airway management.
What'd you say? No, I'm just kidding.
I've already said it 3 times. And remember what they say.
You want
when
me to punch him for
said
you?
3 times. Huh?
You want me to punch him for being a smartass?
Kick him. Kick him where it hurts.
He doesn't have any.
Oh yeah, I forgot.
What?
Oh, Joanna, by the way, I'm having lunch with your company president. President next week.
With my boss man?
Yeah.
He's
Rob?
awesome. Yes, he's my actual boss man. He's my boss.
So I'm hoping to get you guys. Michelle emailed out the clinical clearances, so we just got to get them to the ambulance services, and hopefully in a couple weeks we'll get you guys signed up. Having to help us preceptors, that's gonna have some of you guys. Joanna.
What about me?
Nada. Okay, so going back to August 10th, when I come back from vacation, you will have a quiz, pediatric quiz. And that quiz is a fill in the blank. And I've already given you some of the answers to that quiz. And how do I know? Because I repeated it. I repeated things 3 times. And what do they say when a professor repeats something 3 times?
You're gonna see it on a.
It's an answer. It's an answer to a question.
Yep. You're gonna see it on a quiz. Just saying. I think those are the only hints I'm gonna give you guys.
Are you recording, Lou?
I'm recording, but am I gonna post it? That's a whole nother question.
Nah, that's
I'll post it on August 11th. How's that? All right. In our secondary exam, nothing different than we normally do. We do our secondary assessment, rapid or focused. We've done our vital signs. Pay close attention to the vital signs, especially multi-systems trauma. Remember, we want to be looking for Cushing's triad. Besides Ms. Santana, oh, Sonia, I haven't heard from you tonight, and I haven't seen you tonight.
Yes, sir.
Do you have laryngitis? Or I spoke over you.
No, I was asking what you said. Did you say I
Oh.
have laryngitis?
Yeah, because it sounded like you were whispering.
Oh,
Okay. So what's Cushing's triad?
what's what? You're cutting out.
Cushing's triad.
Cushing's triad.
Yes.
Hypertension.
Okay, good. That's one of them. What else?
Bradycardia.
Okay, good. Bradycardia. That's 2. What's the next one?
Irregular respirations.
All right, good. Irregular respirations. So, Miss Kayla, what does Cushing's triad indicate?
Is that the like pressure and the increased pressure in the brain?
Exactly. Increased intracranial pressure. So vital signs are important. Remember, the important part about vitals is not the numbers themselves, but but how they change over time. Ow. Ooh. All right, we talked about pregnancy, kids, we talked about padding, and adults or old people pad. Nothing different here, right? Still emergency care, suction, O2, says vitals, control bleeding, treat for shock if necessary. And because it's multi-systems trauma and special considerations, reassess them every 5 minutes. You want to make sure you don't have any abnormal changes. All right, so the EMTs arrive, and as they approach little Carlos, they apply inline stabilization to the to the spine, and they open up the airway. They note a pale patient who appears unresponsive and who has labored breathing. We're not happy, are we? So one EMT uses jaw thrust maneuver to open the airway. The other one completes the primary assessment. They insert an OPA and begin assisting ventilation, administering supplemental oxygen. For a 7-year-old, is that bugging you? Does that make you feel uneasy that the fact that they took an OPA and you have to bag them? Yeah. So little Carlos has several superficial abrasions and minor lacerations, but no major external bleeding. So are these injuries something we need to take care of right away? No. They could wait till later. All right, they perform a rapid secondary assessment and provide spine motion restriction, padding from the shoulders to the hips to maintain the neck in neutral alignment. They're transporting within 6 minutes of arriving. Is that good? What's the goal?
10 minutes.
10
And
minutes.
what do we call that? I saw your lips moving, Vanessa. What is it?
The golden.
Rule?
No, that's treat others as you'd like to be treated yourself.
Isn't it platinum something?
Yeah. Platinum what?
Um,
Come on, Vivian, keep it up. Platinum what?
I don't know. I just know it's platinum. And you have to maintain the. You have to maintain the time under 10 minutes.
There you go. So it's the platinum what?
10
No. Platinum what?
time?
No. Platinum what?
I don't know.
You just said it.
Platinum 10 minutes.
There you go.
Oh,
See, I told you said it. The platinum 10 minutes. The golden sun thing. I was about to say the golden shower. the golden hour. It's all Carlos's fault. Man, he's quiet now that Joanna's gone.
You need to pick on someone else now.
Wow, you're so fun. Andrew's so nice and quiet. I can't pick on him. Besides, he's bigger than me. No, it's part of the golden hour, but more specifically, the platinum 10 minutes, which says that you need to be off the scene within 10 minutes of your arrival. So does this kid require the platinum 10 minutes?
Yeah.
Yes.
Yeah, he does. Yeah, he does. So en route, they continue management of the airway and breathing and keep little Carlos warm, as well as obtaining baseline vital signs. They're just not doing that? Okay. Little Carlos is stabilized at a level 3 trauma center, really? Okay, I can see it. And then flown to a children's hospital for further management. Although it's probably because that pediatric trauma center was further away and they needed to stabilize him as quickly as possible. Although he faces months of rehabilitation, the quick action of the EMTs provided him with the best opportunity for a full recovery. So recognizing that it was a kid and it was significant where the kid was unconscious. So earlier we mentioned chest and abdomen, but what other injuries could he have suffered?
A head injury?
There you go. Maybe suffered a head injury. So to maybe determine the extent of the injury, what else could we, and I'm talking about a head injury, what else could we have done to determine that extent? What kind of signs or tests could we have done? 7.
7?
7.
So the capillary refill?
Let me rephrase it. What kind of tests could we have done to assess the significance of the head injury?
We could have checked
Pulse?
his eyes.
Okay, what else?
Pupils?
Vanessa already said it.
Oh.
Good job, Carlos.
His reaction to pain?
How? Or actually, I take that back. So we'll do painful stimulus. What kind of reaction are we looking for and hoping we don't see?
Like no reaction at all?
Okay, that would just tell us that they're unresponsive.
Oh.
Do you know, Santana?
Is it a delayed reaction?
Maybe, but there's something else I'm looking for.
So not that they respond to painful stimuli, something other than that?
Well, they're responding to the painful stimulus. I want to know what response that is. There's two of them.
Is that the flexion and the extension?
Exactly. Flexion and extension. What's another name for those? Or what are the other names for those?
Ooh.
It's what is it again? I'm sorry.
Kayla said flexion and extension. I want to know what other names they go by. We call it posturing. What other types of or what are the other names for that posturing? Besides flexion and extension. We didn't cover it, but it was in the head injury chapter. It's okay if you guys don't know. That's why we're here. One of them is called decorticate posturing. And I'm going to turn off the other screen so you guys can see me.
Decorticate?
Right. Yeah, decorticate posturing. Decort, D-E-C-O-R-T-I, decorticate, C-A-T-E, decorticate. Mm-hmm. And the way to remember decorticate, can you guys see me? Ow. When you apply, my left arm is like dead. It hurts to raise it up. It was worse this morning, but I did some muscle stimulation to it. It felt a little bit better, but it's still bothering me. When you bring it up, or when you do painful stimulus, you'll see the flexion, but they bring it up towards the core, and the arms come like this, so it looks like a T. That's why decorticate. The T in decorticate, so they come up. The other one is called the cerebral. And so instead of bringing it up, they extend. Extension. And they kind of curl their hands and curl their feet.
How do you spell this?
The cerebral, D-E-C-E, R-E-B-R-A-T-E, the cerebral.
T-E-C-E-R-E-B.
Let me put it on the chat.
Oh.
So we have decorticate.
And those are other words for pain.
No. These are other names for the posturing for flexion and extension. The flexion is decorticate, and the extension is the cerebral. I told you about the motorcyclist that missed that S curve and went straight into the hill. So I remember I showed up on that call, and my crew was already there. So I asked them, "Hey guys, what do you want me to do?" And they're like, "Chief, can you just go ahead and do the assessment for us?" They're busy trying to strip them down and get other things done. I'm like, "No problem." So I see the guy kind of there moaning and moving around, eyes closed. Like, "Sir, open your eyes for me. What's your name?" And he's not responding to me. Just all right. So I did a painful stimulus. I think I did sternal, or not sternal. I'm coming. Holy shit, she scared me. Hold on, I'll be right back. I thought about offering to drive a motor to you when I got done, but then the door was closed. Cynthia closed it. I'm like, crap, I don't have access to her office.
Thank you.
All right.
Was that?
Yeah.
Yeah.
Or with class, yeah.
You're still gonna stay?
I might just for a little bit. Yes. All right, you too. All right. So anyway, so I do the painful stimulus on him, and all of a sudden I see that extension, and I'm like, shit. Didn't want to see that. So we packaged him up, off to the hospital he went, and he ended up having a diffuse axonal injury where he fucked up his brainstem, and he became a vegetable, all for riding too fast on a motorcycle. So, posturing. So again, I'm kind of going over it because we didn't cover it in the head. Well, we didn't cover head injuries. The other thing about head injuries, another test that you could do to kind of gauge the extent of that head injury is called the Babinski sign. Anybody know what the Babinski sign is? I want some. It's not fair. Yeah, I could see that. That's okay. I have cheesecake here that I won't share it with you guys on Friday. I gotta see if the girls have finished it up yet. Huh?
Yesterday was my dad's birthday.
Happy birthday, Dad. Tell Vanessa to bring me a piece of cake on Friday.
It's not gonna make it to Friday. It's not gonna make it tonight.
I'll make sure I have cheesecake in front of you on Friday.
Okay.
It's the Babinski reflex. It's one of the normal reflexes in infants.
But there's that one, but no, the this one's a Babinski sign.
Oh.
I don't think.
Is the foot reflex? Oh, sorry.
Oh, sorry.
What were you guys saying?
So it's not this. It's not a sign. It's not a flex. It's a sign.
Yeah. So, have you ever seen doctors, or have you ever had a doctor grab their like percussion hammer and they flip it over, and here's the sole of your foot, and they take it and they run it across? And you could even do it with your thumb, right? So, any of you ticklish?
Yes.
So what happens when somebody like rubs your foot or does something?
Your toes go like.
No, they go down.
Oh,
They go
yeah.
down. Okay, and then you kick.
Yes. I'll kick you.
Thanks. Babinski, a positive Babinski sign is when they do that, instead of curling down like they normally do, they fan out and they curl up. So and I can't do it with my hand, and I'm not showing you my feet. So they curl up and they fan out.
That's a positive sign?
Yes. A positive Babinski sign indicates a severe brain injury because they're so out of it, but that's the reflex that occurs. I'm sorry, the sign that occurs. Positive Babinski. Questions? Comments?
And you said that was when the toes fan out, like positive Babinski sign.
Yeah, positive Babinski is where the toes curl backwards instead of down like they normally do. Like, they say toe curling something.
Yeah.
They go down. But with Babinski, they go up, they flex back, and they fan out. Like my fingers are fanned out right now.
Mm-hmm.
That's a positive Babinski.
Okay.
All right. Anything else?
Yes. Yeah. So I have a question about discernment posturing.
Uh-huh. Yes.
So if we have a patient who is showing discernment posturing, do we just kind of treat them like a stroke patient?
No, because they're trauma. So we have to put them in spinal precautions. And normally a stroke patient, we wouldn't. We lay them on their affected side.
Mm.
So a trauma patient, including a posturing patient, and we call it their posturing. We're going to put them in spinal precautions. So they'll be supine on that backboard. Other than that, it's just take vitals and, do what you can within your scope. What I can do as a medic, I could start an IV. What I'll probably do also is I'll put them on capnography to make sure that we don't have CO2 buildup. Did that answer your question?
Yeah, pretty much.
What part am I missing?
It's because I was reading that the decerebrate posturing can even be a result of a pontine stroke.
Yeah. If we're talking about a medical cause, then yeah. But in this case, since we're talking about trauma, we're going to be treating them as a trauma patient.
Okay.
Yeah, because you could have like a brainstem infarct, and that's going to affect. Well, that's affecting a big part, including respirations. So yeah, it can cause posturing. You have a significant enough injury that it's causing issues.
And do you usually use like a positive pressure ventilation on patients? I mean, if their brainstem is injured or has some kind of trauma, then it can mess up their ability to breathe. That's what I'm guessing. So I don't know if you're able to.
Yeah, you want to, if they're not able to breathe on their own, then yeah, you need to use positive pressure ventilation, because remember, they got to be able to create that negative pressure in order to get air into the lungs. So if they're not able to do that adequately, then we need to utilize positive pressure ventilation, or we need a bag.
And is it better to bag them or to use like the CPAP?
No, they have to be awake in order to use CPAP. Yeah, remember, contraindication for CPAP is where they're unresponsive. But be careful with using too much O2, because oxygen will vasoconstrict, and so we don't want to really close off any blood vessels, because that's just going to make the size, and we call it an infarct. That make the size of the infarct worse, or will make the size of the stroke worse.
Yeah. Okay. I understand. Thank you.
All right, you're welcome. Anybody else? Alrighty then. So before we get done, I want to get a count of who's going to be here Friday and Saturday. I do need help on Saturday, but I honestly need more help on Friday. And so because you guys start at 3, I don't have a lot of time. Now, I don't want to say I'm going to postpone skills until I get the stuff done, but it really is a lot of work to get those stations ready. And really it's, it goes by a lot quicker when there's more people helping, because like I said, we got to move tables and chairs upstairs. We got to get the equipment over upstairs into the different rooms. Um,
I can help Friday. Like, I just need to know the time. Like, you're gonna be there and stuff.
9 o'clock. I'm gonna start as early as possible, but I don't want to start too early.
Okay.
So that way people can get ready and stuff, not wake up extra early.
Yeah.
So, so 9 o'clock on Friday. All right, so I got 4. Anybody else? This is for Friday.
I'll go Friday too.
Who was that? Alexia?
Yes.
How about this? I'll even buy breakfast burritos or lunch burritos, one of the two.
Have you had a bean burrito with chocolate milk?
No?
It's the bomb.
Where are those sold at?
Well, you just like make your own bean burrito and then you buy like chocomilk from the gas station, or you make your own. But it's really good. Like, that's a really good combo. That's
I'll have to try that one of these days. Anyone else for Friday?
I'm sorry, is Friday a skills day, or is it to help out with the EMTs?
Both.
No, Friday morning is to help me set up the skill stations.
But we come in for skills?
And then, yeah, skills is either 3 o'clock or 6:30.
Okay, yeah, if you need help. I'm in.
Any guys? I mean, all the girls, all the ladies are coming in.
Do you still have me listed for Friday, Mr. Lou?
What was that?
Do you still have me listed?
Yeah, I got you.
Hey Lou, I can be there Friday.
Cool. All right, for Saturday, who's coming in for Saturday?
I can go for a couple of hours.
On Saturday, you have to be here at 7 a.m.
Yeah.
I am feeding you breakfast and lunch.
I'll be here for Saturday.
I'll be there on Saturday.
Yeah, I can go Saturday for a couple of hours in the morning. That's it.
All right, Claudia, Caleb, Carlos for a little bit. Anybody else?
Sure, why not?
Joanna had told me she's gonna be here Saturday. Who else? Sonia, you coming?
No, I actually wanted to, but I'm going out of town this weekend.
Okay. How about you, Vivian?
Saturday?
Yes.
Saturday, I don't know if I can. If I can, I could go for a couple of hours as well. But I will be there 7 a.m. if you need me to.
Because I need about, let's see, I need a mother. I need 4 patients. That's 5. I need 6 patients.
Would we be allowed to take notes, like observe them as well?
Yeah, while you're in there, you can observe them.
Okay. I'm down.
What was that, Anna? let's see, I need 4, 5. I need about 7 patients. Might be able to get away with 6, but it makes it better with more.
I can take my daughter and she could be a pediatric if you want. She's gonna want to go too.
Well, I don't want to put her on the. No, actually, I thought it was bleeding control, but it's not. It's joint immobilization. So, so I need like 7 people at the stations, about 2 runners, and a gatekeeper. So I need a total of 10. I got 5. Anybody else? Oh. Okay, I'll try to supplement it with my other EMT classes. All right. All right. What else? All right, anything else? Thank you for helping, guys. You'll see, and when you guys take the advanced class next year, you'll know what to expect. It's interesting to see them. How stressed out they are. I got 2 of them right now that are like totally freaking out. Totally freaking out. It's a high stress test. They can't talk to each other. They can't have their phones with them. They have to have a pass in order to be out of the room. It's a lot of stuff. A lot of stuff. So you guys, it's gonna be interesting. So all right. Anybody have anything else? So we have skills on Friday, test on Monday. Remember, next week I'll be gone Friday, but because it's pediatrics, I kind of want to do that with you guys because of the quiz. So we'll see. But I'll be doing it from, if I do it, I'll be doing it from California. Shit, that's an hour before. Okay, that's fine. I'll try to think of you guys while I'm cruising San Francisco and going on the cable cars and going down Lombard Street.
You could take pictures.
And I'll post them for you guys to see. I'll be like, hi, night class. Greetings from San Francisco. Wish you were here.
Well, I mean, you could take a picture, not a postcard, but.
Jeez.
I'm just kidding.
I actually like San Francisco. So, anyway, all right, guys. I will let you guys go. Thank you. As always, let me know if you have any questions. And bring your skills packets on Friday. We're doing trauma assessments. So, oh, I know how I'm gonna do it. Part of you guys are gonna be with me outside. You guys will be doing the kid and backboard out of my car. Don't fuck up my car. All right. I will talk to you guys on Friday.
Thank you. Have a good night.
All right. See you guys
Thanks.
Friday.
Good night. Bye.
Bye.